So congratulations,
Thank
Lisa.
you.
You're this month's Daisy Award winner.
Thank you.
Were you surprised?
Yes.
Why?
I don't know. I was just surprised.
I'm not. I'm not surprised at all. When I saw your name on there, I was thrilled to be able to come up here and give this to you. I think it's
Thank you.
incredibly well deserved, and I've known you for a long time, so I know how much you deserve this.
Thank you.
So it was
That's so
it was a nice way to start our day to
It
be able to
sure
honor
was.
you. So how long have you worked here on 3 South?
I've been back on 3 South since 2009.
Okay.
I worked on 2 North before that, from 2000 to 2003. And then I went to pain management at Torresdale for 3 years, and then I came here.
Have you always worked here in the Northeast?
Yes.
Yeah, never worked
This is my
anywhere?
first job, no?
Out of school?
Mm-hmm.
Where'd you go to school?
Bucks, and then I got my bachelor's at Walden.
Good for you. Good for you.
Yeah.
So what do you think inspires you to be able to come to work every day and be able to find, I mean, 24 years is a long time, and to be able to find meaning in what you do? Because clearly you do, just
I
based
do.
on what the patients told us.
I do like to make a difference in somebody's life. Like they say, they're always here at their worst time. And if I can make them feel better or make them laugh or put a smile on their face or do something for them, sometimes they don't have a family to come and visit. I do enjoy that.
Yeah. Well, you're good at that.
Thank you.
You're really good at that.
Thank you.
You do that for all of us, too. What do you think in your 24 years has been the biggest challenge for you professionally?
Probably just the way healthcare is right now. It's very difficult. I would say definitely COVID.
Yeah.
We were the COVID unit, as you know.
Yeah. What about that was for you?
It was challenging. It was mentally, it was draining. I remember the first time we had COVID patients, we were all afraid to go into the rooms. Because at that point, you're afraid if you got it, you were going to die, or you were going to give it to somebody and they were going to die. And I noticed that after a few, I would say not even weeks, we were actually going into the rooms wanting to help the patients because we all just, our hearts broke for them. So there was no question. You know, there was times we even went in patients' rooms without mask on because they were struggling so bad, and you just put the mask on as you got into the room. I would say, hands down, that was the most trying time in my career.
What do you think let you or helped you be able to do that? I mean, what you just described, some people would say,
People I work with.
I retire, I'm
People
done.
I work with, definitely. I think we all did it together. I wasn't the only one that did that. Like, I mean, we coded people, and sometimes we didn't have shields on our face, and everybody did that, you know. I think we were very close. We're a very close unit. We work very well together. You know, we all love each other. We can fight sometimes, but we still come together at the end of the day, and, you know, we're still a team.
Well, that's a above and beyond team, right? I mean, really, what you described, and you know, I know, to be able to do that in that kind of circumstance, I don't think the ordinary person does. I just don't. I think, you know, I mean, I know nurses everywhere did that, but I don't think that's the norm in the world. So I think it speaks certainly to our profession, but I also think it speaks to you.
Yeah, I feel like we all did that, you know. I mean, I really did not see anybody on our unit that did not step up and help out, you know.
Yeah, you guys did an extraordinary job, I remember. What do you think has been sort of the high point for you, other than today?
Other than today. The high point. I just feel like whenever I have patients that I can really take care of. I felt like that I said that yesterday with my patients. I just had patients I felt like I was actually doing nursing care for.
Yeah. Well, this patient that wrote this letter, clearly you did that. I mean, that was so obvious in what she said.
That's what I really like. I like when I can actually, no matter what I have to do, sometimes it's, you know, they're incontinent my whole shift and you're cleaning them, but if they're thankful and they feel better, you know, you can make the room better for them. I just feel like if anytime you make somebody feel better when they're in this situation, You know, I feel like you treat somebody like you would want your family treated. And I always do think that. I've always, you know, I've had family members in the hospital, and I know how I would like them treated. And, you know, I just try to treat people. I'm not perfect. I certainly don't do it every time. I have my challenges with certain patients and as well. But for the most part, I would say just making somebody feel like they're going to be okay.
Well, you do that every day. I know that. And I think that is, I mean, that's a great example, I think, because you have the ability in your job to do that for somebody every day. And you just described it beautifully, how you do that. And I think that's a really, when you can find meaning in that every day, you can come to work for 24 years through thick and thin.
Right.
So, any advice you have? Any advice you have for me? Any advice
No,
you have for
you're
any
wonderful.
of us? For all of us? How do you think you come to work every day with that attitude? Because I'm sure there's days you get up and you think,
Absolutely. There's days I come in and I'm like, I'm quitting. I want to go back.
I want to retire.
We all feel
right?
that way. We all
Right.
do. I
So
think any job.
How do you do that? Like, how do you come in every day when you know you feel that way and walk in a patient's room and say, okay, right, I'm not my best today. How do you make sure that you are able to have meaningful interaction with that person?
Sometimes I have to check myself. Sometimes.
That's good advice for all of us.
I mean, yeah, sometimes I know I'm like not, you know, or I can tell right away it's going to be a tough patient or family member, whatever. I try to put myself in their situation, what's going on with them. I just, you know, I do love what I do. I don't always like the situations, you know, that you're put in with healthcare, and I feel like across the board it's the same thing. I have a sister who's a nurse, friends that are nurses. I feel like everywhere you deal with the same challenges. But I do, you know, at the end of the day, I just want somebody, like I said, to feel like they're going to be okay. They have somebody backing them up, that, you know, I'll back them up. I'll advocate for them. I'm very strong on advocating for my patients. That's got me in trouble sometimes, but I push, you know, I will push for my patients.
Always a good thing.
And they'll tell you things, and the families will tell you things. Sometimes they don't tell the doctors or how they feel. So you just have to go with your gut. That's my best advice. Go with your gut.
That's great advice. That's great advice. So, well, thank you.
Thank you.
You are truly extraordinary in every way. But, you know, we are very proud of you. We're lucky to have you.
Oh, thank you.
So thanks for being here, and thanks for coming to work every day.
Thank you.